Ladies and gentlemen, welcome to MedSynapse podcast series, where we connect you with leading experts in the medical world. Today, we have a special guest who is a true expert in the field of diabetes healthcare and prevention, Dr. Sudesna Chatterjee. Dr. Sudesna graduated as a doctor from the prestigious Imperial College School of Medicine, University of London, way back in 1996. Since then, she has achieved amazing success in her career, earning a doctorate in diabetes medicine from the University of Leicester, and becoming an NHS medical consultant specializing in diabetes and endocrinology. But that's not all. Dr. Sudesna's passion extends beyond the clinic. She is the CEO and founder of Happy Healthier Limited, a platform aimed at empowering people to lead healthier lives and reach their lifestyle goals. Today, we are excited to learn from Dr. Sudesna's expertise in diabetes healthy living, lifestyle research, and medical education. Welcome, Dr. Sudesna.
Thank you very much, Dr. Nigar. It's a pleasure to be invited to join you on this podcast today.
Thank you so much for joining us today on our podcast. So, buckle up for an informative conversation on today's podcast on improving lifestyle behaviors and empowering behavior change to prevent diabetes and cardiovascular diseases. Dr. Sudesna, with your extensive expertise in diabetes healthcare and prevention, what inspired you to focus on this particular field?
I have a long history of working with people in diabetes and seeing patients come in with heart attacks and strokes and kidney failure. I have family members with diabetes who've suffered complications. But I think I've just really been inspired by patients who really suffered, and I felt that if only something could be done early on to try and prevent them developing these complications. I've been really lucky to have worked with a lot of experts in the field who have guided me and shown me that there is a way forward, that we can prevent this burden of disease and ensure that people live longer but more healthily. A healthy aging to me is such an important thing. And I think that everyone can make changes in their lifestyle. And that's really what inspired me to think of outside the box a little bit as a doctor. What can we do within the community to help all the people around us to make healthier behavior, lifestyle changes?
Your journey and passion for diabetes healthcare is truly inspiring. It's remarkable how personal experiences can shape our career paths so profoundly. Thank you so much for sharing your story, Dr. Sudesna.
You're welcome.
Now, getting back to our topic, the first question: what habits can cause diabetes and cardiovascular disease, and how can doctors help patients change them? I'm sure our audience is eager to know more about this crucial topic.
Yes, of course. So what I'd like to remind your audience about are two landmark studies that really convinced us that lifestyle behavior change can reap real rewards. The first study, which I think you're probably familiar with, was the InterHeart study. And this was a very large study that was conducted at the beginning of the 21st century and looked at over 30,000 participants to look at their long-term risk of developing myocardial infarction. And this was an observational study, it is true, but it took place in around 50 different countries in the world. And it showed that if people made healthy lifestyle changes, they reduced their risk of developing myocardial infarction around 90%. And these healthy behaviors are really important for us to remember. They include dyslipidemia, so an abnormal cholesterol profile, smoking, hypertension, abdominal obesity, psychosocial factors, consumption of fruits and vegetables, alcohol use and regular physical activity, along with the presence of diabetes as well. All of these factors, which are modifiable, if people were able to modify these factors, then their risk of myocardial infarction would be significantly reduced. So I think the InterHeart study was really quite a critical evidence for us that we need to be able to encourage our patients to make these lifestyle behavior changes in order to get improved outcomes. The second study that I think is also very much worth bearing in mind is the Diabetes Prevention Program. And this was an American study that again looked at a very large number of people who were at risk of developing type 2 diabetes, and they randomized them to 3 different arms. So the first arm was a healthy lifestyle arm, the second one was metformin, and the final one was a placebo group. And they looked at which patients went on to develop type 2 diabetes. And they found that those people who were in the healthy lifestyle group, they were able to reduce their risk of developing type 2 diabetes by 58%, compared with the metformin arm, where the reduction was 31%. Admittedly, the Diabetes Prevention Program was a very intensive study, and patients in the lifestyle group, they had to have 16 patient and healthcare professional contacts over 3 months, which I think is quite difficult to achieve in the real world. But this did lead to a significant reduction in the development of type 2 diabetes. In the UK, we now have an established diabetes prevention program. And as you know, in the real world, we don't always get the same findings as in clinical trials, but still 1/3 of people who complete the diabetes prevention program in the UK do not develop type 2 diabetes. So I think that's still a really significant finding. So really, I think these 2 studies have established the importance of these modifiable risk factors, which I've already mentioned: eating healthily, staying physically active, losing weight, managing cholesterol, blood pressure, not smoking, and not drinking excessive alcohol. These are all very important. And I just want to mention one more very recent study, which just was published just a few weeks ago. This was a Chinese study, again, an observational study, which was looking at around, again, over 30,000 participants in China. It's the Chinese veteran study. And they found that if people from the age of 40 concentrated on 8 modifiable risk factors, they reduced their risk of premature mortality by over 20 years. And I want to tell you about which these 8 lifestyle factors are, because I think they're really worth remembering. So they included, again, being physically inactive, drugs, using opioid drugs, smoking, and also the usual not eating healthily. All of these were very important lifestyle factors, along with a sedentary lifestyle. So I think that, this is what we really have to remind our patients, that look, if you practice good, healthy lifestyle behaviors, will reduce your risk of myocardial infarction, will reduce your risk of type 2 diabetes, and you'll live longer. I think there's a lot of evidence now that this is really the case.
Now, motivating patients to adopt healthier habits can be quite challenging, especially when they have deeply established habits. How do you approach this as a doctor, and what strategies do you find most effective in getting patients to embrace the positive changes?
That's a very good question. It can be very challenging, and often as healthcare professionals, we have time pressures. We only have so much time that we can discuss these issues with our patients. But I think it's useful to have an understanding of some of the underlying psychological factors involved when people are making decisions about healthy behavior change. So one thing that I'd like to start off by talking about is motivation. That is the motivation to change our behavior. And this can be either extrinsic or intrinsic. So extrinsic means your doctor or your nurse or someone in your family is telling you to lose weight or to eat more healthily or to stop smoking. And that's obviously very important to have that advice and education and encouragement. But this extrinsic motivation is not going to be very effective for our patients in the longer term. intrinsic motivation is really what helps drive behavior change. So this is when someone says to themselves, I need to change, I need to lose weight, I need to get more active, I need to reduce my stress levels. So ideally, if, as a clinician, it is useful for us to identify what is the motivation? Is it intrinsic or extrinsic? Because if it's intrinsic, the individual is more likely to succeed. Then I think as a healthcare professional, it's useful to understand certain theories of behavior change. And one that you may be familiar with is the trans-theoretical model for behavior change. It's proposed by Prochaska back in the 1980s. And this is a cycle of change. It involves 6 different steps, which the patient cycles through as they try to make a behavioral change. And it can be applied to anything really, but in this case, we'll talk about health. So the first one is when someone is in pre-contemplation. They are not ready to make any changes. They're not thinking about changing in any way. In a way, they're in denial. And if your patient is in the pre-contemplation stage, then it can be very difficult to convince them to do something about their health. The next stage is contemplation. At this point, the individual, they're thinking about changing, but they're not necessarily doing anything active about it. But they're certainly in the mindset that perhaps they could do something in the future, in the next 6 months, possibly there is a role for behavior change. Then what is really important is when they move into the preparation stage. This is the stage at which they are actively preparing to make a healthy lifestyle behavior change that you are hoping to encourage them to do. So at this stage, say, for example, if they want to eat more healthily, they are looking at recipes, they are shopping for the right sort of foods, they are getting more fruit and vegetables into their home, they are finding out information, maybe talking to a dietitian. This is a very active preparation stage. They have not begun to start working on their habit or changing their behavior, but they are actively doing something about it. And your patient in front of you, if they're at that stage, they're very receptive to what you're telling them. When they go into the action phase, and this is really important because they are actively now doing the healthy lifestyle that you are encouraging, whatever that is. And it's important to encourage patients, but reinforce what they're doing at this stage, because this is when they are actually doing something that will help them, that will benefit them in the long term. And if they're able to maintain their habit for 6 months, they will move into what we call the maintenance stage of behavior change. And at this point, this habit will hopefully be ingrained. They will now be able to consistently perform this healthy habit, whether it is being more active, whether it is eating more healthily, whether this is weight reduction. They're in the phase which is the most promising. Unfortunately, the difficulty is that at any stage in this cycle of change, patients can go back, and they can go back into pre-contemplation or contemplation. The difficulty is being in that maintenance stage or even in that action stage. It's not easy for people to commit long term. And this is what we see with a lot of weight loss studies, that patients manage to lose significant amounts of weight at 6 months, but by 12 months, their weight reverts back to what it was before, to baseline. So I think it's really important to understand where our patients are in the stages of change and really encourage them to move to the next stage as much as possible, but understand that unless they have their own intrinsic motivation, this will be very challenging to do. So I would like to mention one more thing about goal setting, which has been identified as really the way in which we can encourage our patients to make healthy lifestyle changes. So goal setting, action planning, and positive reinforcement have been found to be the 3 key ingredients of the multiple behavior change techniques that are available. There are so many behavior change techniques, it can be difficult to identify which one is right for your patients. And in fact, there are over 80 of them, 80 behavior change techniques that can be identified in the literature. But a recent systematic review and meta-analysis has identified that the three that seem to be significantly related to behavior change, so statistically significant, are goal setting, action planning, and positive reinforcement. So if I can just mention to you how you can set a goal appropriately, there's no doubt that it has to be done in a very structured fashion, and the SMART process is a very good way of doing this. So you may have come across SMART as a method for setting goals, and the way to do this is it needs to be a very specific goal. So if a patient says, oh, I think I need to eat more healthily, that is not really a very specific goal, and one that we should not be suggesting. We should make very specific changes. So we should say, okay, well, what about increasing the amount of fruit and vegetables in your diet? And that is a specific goal. It then needs to be measurable. So it has to be something that can be tracked. Tracking is a very important aspect of goals and goal setting. So the patient needs to have a way of checking, are they actually increasing the amount of fruit and vegetables? Are they getting to their 5 or 10 a day? It then needs to be achievable. If someone is eating hardly any fruit and vegetables, it will be potentially very difficult for them to get to 5 fruit and vegetables in a day if they're only eating 1. So maybe for them, the target needs to be more 2 to 3. That should be their particular goal. It needs to be realistic. Have they got access to fruit and vegetables, fresh fruit and vegetables? Who is doing the cooking in the house or the shopping? Are they helping them are they supporting them with this goal? So we have specific, measurable, achievable, realistic, and finally we have time specific. And I think this is very important. This is, when will they start making the change, building the habit, and when will they stop and review, have they achieved the healthy lifestyle change? So there needs to be a time for preparation, but after that they need to be acting on the change, and then after perhaps a month or maybe 2 months, there needs to be some review of whether the change has actually occurred. So if we use SMART goals, we can more effectively set these healthy habits with our patients and give them something a bit more concrete and robust to work with.
I'm a big believer in the power of stories. Could you share a real-life story where someone successfully prevented diabetes or heart disease by making lifestyle changes?
Yes, of course. I totally agree with you. Patient stories are very important. Listening to the patient story when they come to meet us, or we have a consultation with them, understanding where they're from. Definitely, that is the type of patient story. But yes, more than willing to share a patient story with you. I must admit, it's not often that we get patients who are fully motivated enough to prevent the development of type 2 diabetes or heart disease. But I do recall a patient a few years ago who, when they were told that they had type 2 diabetes, they were very overweight, and they realized that if they lost significant amounts of weight by changing their diet completely, by becoming very physically active, joining the gym, really focusing on losing a significant amount of weight, and I think they lost around 15 to 20% of their overall body weight. This resulted in remission of their type 2 diabetes. They were able to come off their metformin tablets, and their HbA1c had normalized, and they basically really put so much effort into their lifestyle change that they really transformed their medical situation, and their type 2 diabetes went into remission. This took such a lot of effort. It took him, I think, around 6 months of effort to achieve this, but he was motivated to do so, and he was successful, and that was really satisfying.
Hearing success stories can serve as a powerful reminder that change is possible and can make a significant impact on our health and well-being. Now, it's fantastic that patients are making positive changes, but sustaining those habits in the long term can be tricky. How do you support patients in maintaining their healthy behaviors over time?
That's a very good question, and perhaps one of the hardest things that we have to do as healthcare professionals is try and get them to maintain their healthy lifestyle behaviors. You can give them some encouragement by suggesting things like a technique called nudging, which is like a reminder, a visual cue of how to maintain the healthy lifestyle behavior. So, for an example, again, with fruit and vegetables, you can say to them that, have you got a big bowl of fruit on your kitchen counter, so that every time you pass, it's a reminder that you should perhaps think about having some fruit in your diet. Or if they are increasing their physical activity levels, perhaps before they do their exercise at a set time in the day, they should keep their exercise clothes laid out so that they notice them and they put them on, or the same perhaps with their running shoes or their trainers. It's a way of a physical cue, a reminder, what they call a nudge towards doing the healthy behavior. Stacking is another psychological process by which they can build their healthy behavior into their current lifestyle. So, for example, when they're brushing their teeth, maybe they could run on the spot, or they could do squats. That's called stacking. Or say for stress reduction and better sleep, instead of using your electronic device before bed, the patient could be encouraged to maybe read a book, which potentially is likely to help them with their sleep, but also with their stress reduction. So that's the method of stacking habits and also nudging habits together as well. And I think it's just about positive reinforcement that has been shown to help patients succeed at lifestyle change. So when you see a patient and they have lost some weight, then make sure you encourage them. You say, that's really good. You celebrate the success. Or even if their weight has not changed, but they've maintained it as it was from a few months back, you could still say to them, look, it's excellent that you haven't gained any more weight. You are obviously on the right track. And then have a look at what changes they could make to try and maybe lose weight next time. But I think positive reinforcement is important, and also understanding the so-called social determinants of health, understanding that things like food security, housing, economic status, community, all of these are also factors that can impact on a patient's ability to carry out behavior and lifestyle change. And what's going on in their lives is going to impact on their ability to make changes. And sometimes we have to wait for things to improve or change in their lifestyle or in their general day-to-day life before we can expect them to concentrate on their health.
Now, moving on with our next question, with the rise of digital healthcare, online consultations have become more prevalent. I'm eager to know how you use technology for behavior change counseling in the world of digital healthcare, and what are the unique advantages and challenges doctors face when providing this kind of support?
So yes, that's another good question, because obviously since the COVID pandemic, there has been a massive move towards digital healthcare. Obviously, a lot of us were already doing it to an extent before the pandemic, but after the pandemic, it's definitely become more of an option that we offer our patients. I would say that I think if you can at least see the patient face to face for a few consultations, that is valuable, because digital consultations, you lose a lot of the body language and rapport that I think you build up if you're in the same room with your patient. But I think as an adjunct to good healthcare, digital healthcare is important, whether that's by telephone consultation or video consultation. And I think you really just use the same techniques. You make sure that when you are goal setting with the patient, you use the SMART method, you use action planning, you identify how motivated the patient is to change, you use positive reinforcement and encouragement, and you basically treat the patient as you would in the room, while realizing that, of course, it is not quite the same. Yes, it's maybe allows you to have more contact with the patient, more regular contact, but I think that one should schedule some face-to-face contact as much as possible as well, because I think that is the ability to connect with your patient is much greater if you are sitting next to them.
Personalized medicine and genetic testing have become more advanced over the years. Now, how do these tools help doctors provide tailored advice for behavior changes?
So I think this is really quite an interesting area of research. And we do know that obviously there is a very significant link between genetics and the environment. I don't think we're at the point yet, and I've also reviewed the literature, the medical literature extensively to have a look at where we are at this point in time in relation to the application of genetics, genomics, and personalized medicine in terms of behavioral change. We do know that that epigenetic phenomena can actually alter the gene sequencing through DNA methylation, and this can affect the patient's outcomes, whether it's heart disease, whether it's developing type 2 diabetes, etc. There is actually some genetic modification that is related to lifestyle. So there is a link there. We also know that the gut microbiome, which is a really extensive area of research at the moment, can be affected by environmental factors, especially diet and stress and sleep. So we know that those areas are something that perhaps genetics can be affecting. But unfortunately, at this stage, it's difficult to say that there are any particular genetic areas that can be altered to improve behavior change or the ability to modify lifestyle. There's ongoing work in this area, but I think that lifestyle behavior change is still remains the focus rather than any genetic therapy that we can really offer. In terms of personalized medicine, I think that it's the introduction of artificial intelligence may help with personalized medicine. If we're able to put in the variable characteristics of patients, in terms of age, ethnic origin, comorbidities, this kind of thing, and then an algorithm can tell us what is the best type of lifestyle change that would be recommended for this individual. For example, and I'm just giving an example here, say a postmenopausal woman who is at increased risk of cardiovascular disease. So you would input her age, the fact that she's postmenopausal, and you would then get specialized, tailored advice on the importance of strengthening exercises because she is at risk of osteoporosis in the future, or she should now really consider optimizing her blood pressure and her lipid profiles. So this might be a form of personalized medicine using algorithms developed via AI technology. And I think that this might be something we will see more in the future, but we have a tailored healthcare plan which is for the individual in front of us rather than a more generic plan that we will offer just anyone. So it would be tailored to lifestyle, age, gender, that sort of thing.
Community resources can be invaluable when it comes to helping patients make positive changes. Dr. Sudesna, what resources do you often recommend to your patients, and how do these resources enhance the overall treatment plan?
So we're quite lucky in the UK that we have quite a lot of resources available. So we already have a lot of resources for stopping smoking and for screening for various cancers. We have heart checks, so healthy heart checks from the age of 40. So patients are able to access these through their primary care physicians. We have a lot of work on community, so cycling is encouraged, and there's a lot of information on local kind of groups for healthy eating and walking groups and running groups. So it's all about having options for the patient. We also have vouchers for people to attend the gym who can't afford to do so. So we can do what we call exercise prescriptions. So all of these are ways of getting people to be healthier, but supporting them. I think it's also important to remember that the councils or the local governments have to also help provide the infrastructure to make people get healthier, to support them. So by having cycle lanes, by having good public transport, by having green spaces, have community programs for encouraging children and families to get healthier. I think there's so much that can be done, and a lot of it is happening, but it's making sure that individuals are signposted to all of these so that they are aware. So it's really important that local governments and councils signpost the patients and raise awareness in the community of all the things that are on offer.
Now, when working with young patients to avoid diabetes and heart diseases, now this might come with its unique challenges, right? Can you tell us more about these challenges and how you approach helping young patients develop healthier habits?
Yes, I think it is a real challenge, and I think at the moment I'm working in North London in a community diabetes clinic, and there I'm seeing so many young people with type 2 diabetes who have had relatives with type 2 diabetes, so they've grown up seeing it. A lot of the time, both their parents have type 2 diabetes, a sister and brother might have type 2 diabetes, and these are the people that really we need to concentrate on. When I see them, they've already developed type 2 diabetes, unfortunately, but they're the ones that we should have been targeting because they were at risk, and they were at risk in their teens, in their 20s, in their 30s, and this is when they're actually developing type 2 diabetes instead of having had the option to change their behavior so that this would not have happened. And I think that we need to address the fact that a lot of people think that if there is diabetes in their family, then they are inevitably going to get diabetes themselves. This is not actually the case. There is very good evidence that obviously we can prevent diabetes, and we need to educate young people to understand that their risk can be reduced if they make the appropriate changes. So I think we have to try and look at inevitability and try and realize that that's something we need to overcome. We need to look at a degree of inertia, shall we say. So when people are young, they just think that they're going to have a really healthy life ahead of them. They don't realize that whatever they do at a young age is going to really make a difference in the future. And it's really trying to get that message across that while you're young, if you can develop healthy habits, then when you're in your 40s, 50s, 60s, you will be so much better off. So how can you do this? I think you have to be positive about it, ultimately, rather than tell them you're going to get all these diseases. Just really remind them that healthy aging is so important and that there isn't anything inevitable about becoming older and having diabetes or having heart disease or having dementia or becoming frail or not being able to do things. We can carry on being able to lead a really fulfilling, healthy, strong life, even if we live healthily early on. So it's just trying to have a very positive reinforcement, positive, how can I put it, really explaining that aging is not about getting worse. Aging can be very enjoyable if we remain healthy, and we have to build those healthy habits sooner rather than later. I don't know what you want to, if you have any comments about that, about the difficulty in managing younger patients, or what your own views are on the subject.
And now, let's delve into a topic that's crucial for every doctor's practice. I understand that time during appointments is often limited, so focusing on key behavior change topics becomes crucial. In your experience, what behavior change topics should doctors prioritize to maximize the impact on their patients' health?
Another great question. Thank you. I think some of the really easy wins would be something like stopping smoking. That has got to be up there. That every time you see a patient who is still smoking, you have to remind them that this is a behavior that they will have to address at some point. Again, if they're not there in the cycle of change, if they're in the pre-contemplation stage, they may not particularly respond to this. But I think this is so important if we want to try and remind them that their health will improve. This is one change that they should really consider doing. So stopping smoking. I think the next thing would be, this is something we don't often talk about with our patients, but sleep. I think we should ask them about their sleep, because if they're not sleeping well, then their ability to be physically active the next day, their ability to make healthy eating choices, their overall stress levels, all of these will be impacted by poor sleeping patterns and quality. So it might be useful to just quickly ask the patient, how are you sleeping? And see if there's anything that you can help to advise them on, improving that particular factor. And then I would just ask them about fruit and vegetables and fiber. There's 3 things in their diet. Are they having enough? Is this something they could think about improving? And then just healthy moving. Just where are they in terms of physical activity? Can they move to the next level with that? Can they be taking more steps in their day? Everybody knows about taking 10,000 steps per day, but actually only 500 extra steps per day can reap health rewards. So it's just about making some suggestions and just getting the patient thinking that this doesn't have to be so difficult. They don't have to be running a marathon. They don't have to be having a diet where there are no treats or nice things, but they just need to be nudged towards slightly healthier habits and realizing that it doesn't probably take as much effort as they actually think.
I'm sure many doctors in our audience are interested in optimizing their patient interactions, and your insights on prioritizing the topics will be incredibly valuable to them. Thank you so much, Dr. Sudesna, for sharing your expertise on this vital topic. I'm sure our audience has gained valuable insights, and your contribution has been truly invaluable to us. Thank you.
Thank you very much, Dr. Nida. I really enjoyed speaking with you today. And again, it was an honor to be here at this podcast with you today.
Before we wrap up, we would like to take a moment to acknowledge MedSynapse, a platform that fosters collaboration and knowledge sharing among healthcare professionals. Subscribing to MedSynapse will keep you updated with engaging discussions and provide access to a wealth of knowledge from our expert doctors in the medical community. And with that, we conclude today's podcast. Thank you for joining us. Stay tuned for our next episode, and until then, goodbye.